Today we are faced with the riddle of sacroiliac joint pain. Some believe their joints are as fragile as a house of cards, constantly fretting about perfect alignment. Oh, what?
Stop right there. Bad posture detected, detective.
But just like this house of cards, obsessing about alignment can be a recipe for disaster indeed.
Au contraire, doctor. Alignment is everything. If it's not perfect, everything falls apart.
Ignore the posture police. What if instead we focus on strength and stability?
Whoa, you're out of line, buddy. You can't bend the rules. If you don't shape up, I'll set you straight.
It's elementary, my dear. We could try to balance the body precisely, or we could focus on making the body strong so that no matter what life throws at it, you're unbreakable. A bit cattywampus, but no more than you and I. And no danger.
In today's video, I'll show you how to diagnose and treat sacroiliac joint pain and move beyond the fragile mindset to build true strength and resilience. Let's uncover the truth. In part 1, I talked about my patient, Liz. Now, when Liz came to me, she had no idea what the source of her pain was. So we did a couple of simple tests to determine if the SI joint was involved. First, we checked to see if the pain was even located near the SI joint. And then we stressed that joint to see if it caused symptoms. So let's do the same thing for you. Start by finding the top of both of your pelvic bones, which is the fancy name for your iliac crest. Then work your way down around the back until you find a bony bump. On me, it would be located right here. This is called your posterior superior iliac spine, or your PSIS, and it's a pretty good approximation of where your sacroiliac joints are located. So if your pain is located near the PSIS, then you might want to move on to the SI joint stress test. Now, for these stress tests, it is best to have a partner. For the first test, you're going to lay down and have somebody press on the front of the hips on these bony bumps right here, the ASIS. We're going to press with the palms and press down, and we're trying to press outwards to spread the sacroiliac joint. When you do this, it's not going to feel good on this little bump right here. This is going to hurt, but this doesn't matter. What we want to know is, does it reproduce your back pain? For the second test, a partner will pull your hip into 90 degrees of flexion and then press down on the top of the knee, using their body to press down and load down. Again, we're looking for pain in the back. So if I did it on this person's right side, I'm looking for right-sided sacroiliac joint pain. Next, from the same position, the person will hold one knee into the chest, and while they hold this knee into the chest, they'll take the opposite leg off of a table or a bench or a massage table or something like that, and you'll stretch. You push the knee so the pelvis remains in posterior tilt, and then we extend the opposite hip here. So we're trying to create anterior tilt on the right side and a posterior tilt on the left side. So we're trying to create torsion in the SI joint. So we press here and see if that hurts on the right side. Whichever side is down is the side that you would expect pain. Next, we're going to flip the person face down, and your partner is going to feel for these bony bumps called the PSIS. When you find them, these are right next to where those dimples are in your low back. So you find those dimples, and then you find the bumps. Take the palms, press, and thrust down. And if this causes pain over the low back, then it's probably sacroiliac joint pain. For the next test, you lay on your side, your partner finds the iliac crest, the bony ridge above where a waistband would be, and they press down repeatedly, and we look for pain in the back in the SI joint. It's probably not going to feel good over the bone that they're pressing on. That doesn't matter. We're interested in back pain. One more for good measure. This is not technically part of Laslet's cluster, but I like it anyway because it's easy. While you're laying down, your partner will bend your knee, pick up your back leg by holding it with their hand, and then take their right hand, if I'm doing the right side, take the right hand over the PSIS, and we're lifting the hip into extension as we press down on the pelvis over where a belt would go, but we only do the right side. So I'm pressing down on the right side as I lift the hip up. Now, please be careful with this on your partners, because this alone, just putting pressure, if that causes pain, there's no need to do this, because this is obviously going to cause more pain. So just skip this test. But if pressure alone doesn't really cause pain, then it's okay to put some pressure and lift the hip into extension. And if then we get pain on the same side that we're lifting the leg, probably SI joint pain. Now, if 3 or more of these tests cause pain near that PSIS, then your pain is probably coming from the SI joint. Now, don't confuse these tests with motion palpation. Liz had a lot of chiropractors, physical therapists, and massage therapists who told her that they could feel that the SI joint was misaligned with their magic hands. But unfortunately, they were hallucinating. Balderdash. A bunch of bumbling boneheads babbling about me being a bogus backbone buffoon. That's just bad behavior. Okay, we need evidence. So this systematic review and meta-analysis shows that even trained chiropractors and physical therapists cannot accurately diagnose SI joint dysfunction by feeling with their hands. Now, the cluster of tests that I showed you is easy to do with a partner, but it's worth mentioning that the gold standard of SI joint pain diagnosis is a nerve block. But even that, unfortunately, has some unreliability. Now, a nerve block is when the doctor numbs the SI joint nerves, kind of like Novocaine when you go to the dentist. And if a person's pain goes away, then the SI joint was probably the source of their pain. But that process is not necessary unless somebody is considering surgery, which most of the time is not necessary. Now, fortunately for my patient Liz, she did not need a nerve block. Location and stress tests were enough to diagnose her with SI joint related pain. So if you have SI joint pain, is it serious? Probably not. Most cases of SI joint pain are just irritation of the joint. There isn't actually any pathology or disease. But there are a couple of exceptions. First, there's a group of inflammatory arthritis types called seronegative spondyloarthropathies that can cause degeneration, inflammation, and even fusion of one or both SI joints. Now, signs of an inflammatory arthritis include redness, swelling, pain, stiffness, heat, and loss of function. So if you're experiencing these symptoms in multiple areas of the body, you might want to talk to a rheumatologist. Second, the SI joint can become infected, and we call that sacroiliitis. So if you have a fever, fatigue, and severe SI joint that all started around the same time, you probably want to get that checked out by your medical doctor immediately. Now for Liz, just understanding the difference between really serious stuff and normal joint pain, plus understanding that her joint was not out of place, really put her mind at ease and accelerated her rehab. So what did we do for Liz? Well, step 1 was to rule out red flags like infection and inflammatory arthritis. We just did that. Step 2 was educating her on what to do and what to avoid during back pain flare-ups.
And step 3 was fixing her alignment and pelvic tilt, right?
No, literally the opposite. In the past, she was told never to bend her spine and make sure she maintained perfect posture and perfect pelvic tilt all the time. And this made her back stiffer and tighter and made her pain worse. And research shows that all of this posture and alignment obsession is really a bunch of outdated trash. What she really needed was to do meaningful activities. Stay strong, get active, keep working, avoid bed rest, and most importantly, stay positive throughout the healing process. And for Liz, and for many of my patients, we also needed to address her high stress levels. And this is because we know that people with high stress are nearly 3 times as likely to have chronic low back pain. But many other factors also contribute to chronic pain. For example, social health, excessive alcohol use, smoking, obesity, sedentary lifestyle. These can all contribute to chronic pain. So it's important to zoom out and look at your life as a whole rather than getting obsessed with a single joint. So in addition to this general education, we also dispelled some harmful myths that Liz believed. And if you want more detail about those myths, check out part 1 of this video. All right, let's move on to the next step. exercise. Now, the good news is that people don't need a bunch of complicated posture correction, alignment-based exercises. They just need a clear, step-by-step exercise plan that intentionally progresses them from easy to medium to hard things to eventually build full body strength. And this systematic review and meta-analysis showed that an extra focus on leg and back strength can give you even better results. And I do mean strength. Some of you are terrified of deadlifting. Now, this review paper showed that deadlifts are safe and effective exercises for back pain rehabilitation, as long as you start small. And I want to add that I personally used to have chronic SI joint pain, among many other types of chronic pain. And when I stopped doing a bunch of deep yoga stretches that exploited my hypermobility and started deadlifting and getting strong, I fixed my pain and never looked back. Also, yes, my SI joint did actually get a little bit worse for a few weeks while I was starting to weightlift, but long term, now it's not a problem anymore. All right, now back to Liz. She needed a detailed rehab plan, and we broke that plan into 3 phases. And I'll mention that we weaved education, meditation, and other stress reduction techniques throughout the entire 12-week program. So the goal of phase 1 was to strengthen and mobilize the SI joint without flaring up her pain. Notice I did not say realign or fix muscle imbalances. Now, this is where most physical therapy starts and ends. Doing things like cat-cows, bird dogs, clamshells, glute bridges. This is a fine place to start, but it became too easy for her within about 2 weeks. And most physical therapy just sort of stops at this point and sends you off on your own. But for Liz, this was really just the beginning of the journey. So next, in phase 2, we wanted to increase low back and leg strength with functional movements for the full body in every direction. And that's because Liz wanted to get back to pickleball, hiking, weightlifting, and picking up her kids. So to prepare her specifically for those things, we did a lot of loaded twists, oh no, lunges, light plyometrics, and hip hinging. So can you see how those exercises specifically helped her aim for her unique goals? And then we gradually increased the amount and intensity of her hiking and got her back into easy pickleball practice. And by the end of phase 2, Liz's SI joint was back to its pre-injury strength. And again, many people stop here, but we kept going in order to future-proof her back. So phase 3 consisted of a full body strength and conditioning program working up to heavy weights designed to help Liz reduce her future injury risk. Now this looked like a 3-day per week full body workout routine with strength and heavy weights to help keep her healthy and prepared for activities like pickleball, weightlifting, and random things that happen playing with her kids. And again, I want to emphasize that within 12 weeks from starting with her, she was able to lift heavy weights. At least, heavy for her. Now, beyond exercise, there are a lot of other adjunct treatments that you can do. A lot of people like chiropractic adjustments, and they can help with pain and function. We do have studies showing that even just one adjustment can give some temporary pain relief. But remember, adjustments should not be the only treatment method. And please remember, an adjustment does not literally realign your joint. I broke it down in part 1, but that is a myth. Other pain modifiers like, kinesiology, tape, foam rolling, acupuncture, myofascial release, and cupping may be useful for short-term pain relief based on personal preference, but the research and effectiveness for SI joint pain is pretty weak for these things, so it really comes down to personal preference. Okay, what about injections? So injections like steroids or nerve blocks can be helpful for some people who have really genuine inflammatory arthritis in the SI joint, but even then, it should still never be the only treatment. You still need to get strong and live a healthy lifestyle. Also, those are not a good choice for everybody. For example, patients who are on blood thinners, pregnant, or have diabetes should probably avoid injections, and patients with an allergy to whatever is being injected should obviously avoid those. It's also worth mentioning that some people have had complications with injections. Fortunately, usually these are just minor injection soreness related events, or it just makes the pain a little bit worse, or you get facial flushing or sweating, and severe complications like bone infections can happen, but they are pretty rare. Okay, believe it or not, I've heard people talking about fusion of the SI joint through surgery, which to me seems crazy, but let's look at the evidence. So if you do decide to get an injection, make sure that you're prepared to go down the road of talking about surgery, because if the injection doesn't work, they're probably going to send you to a surgical consult. Now let's be clear. Surgery is an absolute last resort. The evidence supporting surgical fusion for the SI joint is a level 5, meaning it is the worst possible tier of treatment. Literally everything else that we've talked about is way, way, way more effective than surgery, not to mention less risky. Right? When people do decide to have a surgery, about 6% of them need to have a second surgery, and then 5 to 20% of them have some type of major complication. Satisfaction rates are only about 54% for an open surgery and 84% for minimally invasive. So obviously if you're going to get surgery, minimally invasive seems to be the best option. And even if you do get surgery, you still can't escape the fact that you then, after surgery, need to do a solid exercise rehabilitation program and live a healthy lifestyle. So if you have to do that stuff anyway, why not just start with a holistic or integrated approach and really take it seriously? Literally give it all you've got and do that first. Today we learned how to identify SI joint pain and what to do about it. Now, if you have pain around the area of your SI joint and the stress tests were positive, then there's a good chance that your SI joint is a factor in your pain. But remember, this does not mean that your joint is out of place, so ignore the posture police. You do not need to fix your alignment, and it does not mean that the SI joint is the one and only thing contributing to your pain. Remember, pain is always multifactorial. Now, just like my patient Liz, understanding that your joint is not out of place and instead focusing on education, lifestyle change, and exercise can make a huge difference. So stay active, ignore the harmful myths, and look at the bigger picture. Yes, manual therapy like adjustments or foam rolling can be good for short-term pain relief, but should not be the only treatment. Injections and surgery are a last resort. If you suspect an inflammatory condition or infection, obviously go ask your doctor. Now, if you want the same type of customized plan that helped Liz, check out the free masterclass and book a call. The link is in the description. And I'll see you in the next video.